afternoon, everyone. I'm Ryan, and I'm here with Chad Valentine and Phil Patronella, and a lot of trainings in the past, so this is answer those as we go along, or if they're lengthier questions, we will take them at the that. I will turn it over to Chad.
All right, well, good afternoon, everyone. Like Ms. Ryan just mentioned, my name is Chad Valentine. I'm the PDHRA Program Coordinator. I work out of the OTSG office. So before I get started, I want to go ahead and make sure everybody can share see my screen here. And what you should see is a PowerPoint here. So is everybody able to see the Aspire PowerPoint up right now? Does anybody have any issues or anything? All right, if not, I'll go ahead and take the silence as a good thing. We'll go ahead and begin. Basically what we're going to be doing today is doing a refresher training. This is for the 2012 DHA forms. We did this training back in January and February. We went over the some of the background and the logic revisions on the the post, and the reassessment. So what we wanted to do today was just give her some refresher training. We had some providers who weren't able to make that training and may still be has some questions or some issues, so we wanted to cover down on that today. What I'll be doing is going through a brief PowerPoint here, and then we'll go in and jump in the MHA, the Medical Health Assessments application, and we'll do a hands-on demo. So if you have any questions, please feel free to jump in at any time. I'm going to keep this training easy and light, so like I said, if you have any questions for me, we also have Phil Patronella up in the room, so feel free to chime in. So I'll go ahead and jump into the PowerPoint. We'll go through the agenda here first. Basically what we're going to be doing today is going over the background or deployment health assessment forms. We're going to touch down on the mental health training requirements, and I'll actually be showing you this on a hands-on demo as well as, was there a question? Oh. We'll go in through some of the training that is required now that the mental health assessment questions are included into the PDHRA. I'm going to touch down on some of the revision highlights of the new 2012 forms. We're going to go through some of the automated logic updates. And once again, this is also going to be hands-on. We'll actually go through the application so you can see them. I'm going to demonstrate how we can do the documentation of the deployer responses into ALTA. We'll go over a summary, answer any questions, and then we'll jump into MHA and we'll do the training and the demo. Okay, once again, the purpose of this briefing is basically to give you guys information as well as a review of both the DD2795, DD2796, and the DD2900. We're going to be touching on the topics that I described in the agenda, the background, the mental health aspect of the new forms, the revision highlights, going to go through the automated logic, and touch down on the documentation into the ALTA application. So I'm pretty sure for the providers we have on the line, most of you are pretty familiar with the DHA application. The Deployment Health Assessment's sole purpose is to gauge and monitor a deployer's mental and physical health before and after deployments, and we do that with the 3 forms. The pre, 60 days prior to deployment, the post-deployment, 30 days after return, and the PDHRA, the post-deployment health reassessment, is 90 to 180 days after redeployment. These forms are required for deployments. They're more than 30 days without a fixed location, or a fixed MTF, medical treatment facility. This is also it's at command's discretion whether it's required or not. The assessment itself, it's basically used to establish, ensure that personnel are addressed for any physical or behavioral health issues, the need for any additional screening, basically referrals. We also want to ensure that the indicator referrals are documented and any additional screening or referral care is obtained. And on the right here, if you guys can see the PowerPoint, I have one of the forms here showing you. This is the DD2795, it's the pre. I'll give you guys just a brief background. The pre-DHA, the DD2795, was initiated in 1999. It actually hasn't been revised since, so it was a long time coming for us to update this form. Both the post and the reassessment were last revised in 2008, and before that it was revised in 2005. So those familiar with the MedPros applications, you'll see that when you go in there and run your aggregate reports, you'll have a 2005 version of the report, a 2008, and now right now you have a 2012. Before that, I already mentioned it was done in 2005. Okay. The 2012 DHAs, some of the new functionality and aspects that we have incorporated in these new forms are the congressionally mandated mental health assessments. You'll see that there are the mental health assessment questions from the SAT, the SAT forms are incorporated in the PDHRA. And when we go through the hands-on training, I'll point that out to you specifically. And because of those new questions that are incorporated in the reassessment, you guys the providers are required to complete some mental health assessment training. And in a couple of slides, I'll have the link to that where you can go in and do the self-paced training. I think there's a 20-question post-quiz for you to get your certificate. We incorporated some provider feedback through the years since the 2005 version. We've gotten a lot of feedback from the providers who actually utilize this form for all three compos. So we did incorporate some of the suggestions and enhancements from those providers in the new design of the form. We've incorporated some of the research since the findings of the last revision of the forms from the 2008. The new automated logic that you guys will see once we go through the healthcare provider portion of the tab is used to assist in completion of assessments. So when we go through there, you'll see that they'll have highlighted areas to indicate positive responses. You'll have drop-down pick lists for referrals. So it's really there to help the providers guide them through and completion of that form and indicate all positive responses or any issues that the soldier has. So you don't have to go fishing for those. I know there was an issue back in the past with the previous version of the forms. Were there any questions so far? Okay, so like I mentioned before, there is mental health assessment training that is required because of the SAT form questions that are incorporated in the PDHRA. I have a website here. You'll see a link here on this slide. It's got the link to the slide deck. It's approximately 75 slides. So if you guys haven't completed the mental health assessment training, this PowerPoint is on the file share, so it has a link there for you to go ahead and click, and you can see the 75 slides. And there's a link there for the MHA post-test. I think there's 20 questions on this test, if I'm not mistaken, and from what I heard from the providers, it's pretty painless. If you guys, providers, if you have any issues with accessing any of these links, please contact myself. We did have issues with some of the providers during the email conversion to the mail.mil. They weren't receiving their verifications to go ahead and proceed to the site to complete the test. So if you guys are having those issues, let me know and I can help you out and get you squared away. Once you complete that training, you'll be provided a certificate, so you want to make sure you place that in your privileging file once you complete it. Okay, so we're going to touch on some of the revision highlights. First off, there's been reorganized question sequencing for better subject flow. You'll notice when you're going through the forms, all the alcohol-based questions are grouped together, all the PTSD questions are grouped together, depression questions, so it's a little easier to follow. The questions are standardized across all three assessments, so you'll see that there is some uniformity across the pre, the post, and the reassessment now. We do have tables, or what we refer to as matrices and MHA, that indicate provider action. As you can see in the screenshot we have there, it's highlighted in yellow. So whenever there's a provider comment or the mandated provider comment, or when the provider needs to take action, the healthcare provider tab will indicate that with a yellow highlight. As well as these matrices I just spoke of, there's one for the physical symptoms, alcohol consumption, PTSD, and depression. It's basically a data table which will compute the severity. It will give a tally up points based on the severity or the risk category that the soldier falls in, and it will display that for the provider, so to aid you guys in the treatment and diagnoses of the soldier. And when we get to the hands-on demo, for those of you who haven't seen it, I'll go through and I'll demonstrate it for you. There are drop-down pick lists for the providers to facilitate documentation, meaning that when you want to indicate a referral, you can choose what type of referral, and you can choose multiple referrals based on the positive responses given by the soldier. There's increased size of many of the free text fields. You notice that you'll have anywhere from 250 to 600 characters and some of the provider comments boxes when going through the healthcare provider portion. All the deployer free text field containing any free text from the deployer are now going to be displayed on the HCP tab, which we call the Healthcare Provider tab. So you don't have to highlight the questions to see those responses anymore. They'll be highlighted in the deployer's response or concern box. Like I said, I'm going to be showing you guys all this when we go through the demo. But it's going to be displayed for you, as well as the positive responses highlighted. So it'll kind of guide you there for any of the issues that the soldier has. You'll be able to see it on the form. Okay, and once again, like I said, the yellow shaded boxes indicate the need for information from a provider, meaning that you have to leave comments because it was a positive response. Another addition for the new form implementation was the creation of the SF600. This form is attached to the PDF version of the DHAs. So basically with this, if you do have some free text from the soldiers, if you have a response that exceeds the character limit, what will happen is it'll carry this text over to the SF600, and this will actually print out with the form. And I don't know if you guys can see the screenshot pretty clearly from where you're at, but on the graphic on the left at the very bottom, you see where it says CSF600? That's because in this response where it says please yes explain, the soldier exceeded the character limit, and this actually carried over to the SF600. So when they print out, you actually see the question along with the text from the soldier. So it doesn't cut off the response, that text response from the deployer, which I know was an issue in the past. So this will all carry over to the SF600, and it is attached to that PDF version of the form, and it will print out. Any questions so far? Carry over all the text. The SF600 when they exceed the 250 character. Right. Well, can you let that person know who's typing that? Oh, okay. I don't know how to pronounce the name. Is it Jaram? I'm sorry if I'm murdering your name, Jaram, but I've seen the response that you're typing in the chat box with the character issue. I can get with you after the training and find out what issues you're having with that. Oh, Dr. J? Okay. I can definitely get with you the training and find out what the issue is. Okay, continuing with the automated logic. Positive responses and negative responses were basically determined by a tri-service work group. When designing these forms and designing the logic for the new forms, basically what they did is they took providers from all three services, threw them in an office together, and this form, the three forms are the product of that work group. So this is all created by providers. The positive responses and negative responses and the self-assessment portions of the DHAs are indicated in the provider portions. Basically, when the deployer is filling out the form, whether they have a negative answer, meaning it was a no, it was a negative response, positive response, or if they just did not answer that question, and I'll touch down a little bit more on that, how they're able to do that as far as not answering the questions. But no matter if they don't leave a response, leave a negative or positive response, that is reflected on the healthcare provider portion of the form when you're going through doing the assessment with the soldier. So you'll be able to see all responses. For example, the example we have on the slide, that if the deployer does rate its health as poor after a deployment, it's indicated as a positive response, and they'll actually have follow-up questions asking why that soldier had a poor, he rates his health as poor, and you'll see it in the deployer's response to concern box in this graphic. If they do indicate a concern, it's going to prompt them to have list some text. Free text will give you a little bit more information on what the issue is, and it'll actually display in that deployer's response or concern box. And for those of you on the line that haven't seen it, when we go through the demo, I'll be demonstrating that. All right. What we have on the screen now is our PHQ-15, the graphic PHQ-15 data matrix. This is what I was speaking of earlier, these tables that we have that'll go ahead and it'll tally up scores based on the positive responses for the soldiers and lift them and actually list them in a risk category. We have one for the physical symptoms, we have one for the PTSD, we have one for the screening, and we have one for the alcohol consumption. So you have three matrices here. And the one that we have displayed now is the physical symptoms. For those of you who've seen the form, you'll notice that there's about, I think, 10 to 12 questions where the soldiers provided or the deployers were provided with specific physical symptoms, and they have 3 possible responses: bothered a little, bothered a lot, or not bothered at all. And what the system will do in this specific instance is it'll go ahead and list all the symptoms that the deployer was bothered a lot by, and it'll group them, and you'll see that in this top column here. And then it'll take the symptoms that they were bothered a little by and group them in the column below. And then what it'll do is it'll go ahead and it'll calculate a PHQ-15 symptom severity score, and it'll place them in a category between minimal, low, medium, and high. So these tables here are just used to guide the provider and the treatment given for that deployer. So like I said, you have 4 of these different tables, and it'll go ahead and it'll compute the totals for each one of these tables here. And I'll be showing you guys this when we go through the demo, for those of you who haven't seen it yet. Like I mentioned before, on the provider portion, you'll actually see all responses. So if a soldier does or a deployer does have a negative response, it will show that there's a negative response. It'll say NA in deployer's response or concern. If they decide not to answer in this deployer response, it'll just say not answered. And of course, if it's a positive response, the provider comments box will be yellow, indicating that it's mandatory for that provider to leave a comment because it was a positive response. Okay, and I have examples of all 3 of these different scenarios for those of you who haven't seen that on the provider portion of the form. One of the new functionality with the forms as well is the documentation in ALTA. Once a provider completes the assessment or the interview with that deployer and he actually signs the form, what it's going to do is it's going to take all the questions from the form along with all the responses by the deployer, which you'll see in this little in the graphic below. It's going to be in red text, and it's going to automatically copy that to a clipboard. So all you need to do as a provider, it's already copied. You just, if you have your ALTA Encounter open, you just hit right click or paste, or you can hit Control V and it'll paste everything in there for you automatically. So this pops up automatically. It copies everything to the clipboard. All you need to do is right click and paste. Now I'm a little unfamiliar with ALTA. I don't know exactly where you guys paste it in there though, but when I go through and demonstrate it, I'll just do it in a Word document to show you what it looks like. Okay, so just as a summary, we went over the revised assessments and how they incorporate many of the new enhancements. The revised deployment assessments include the mental health assessment, the MHA. So we basically took those questions from the SAT form and incorporated them into the PDHRA. Therefore, that's why you need to do that mandatory mental health assessment training. MHA is required, and we went ahead and we posted this PowerPoint onto the file share. Is that what's called? The file share. So when you guys go on there, you'll have the links. And of course, as I mentioned, if there's any issues with any providers who have not taken that training yet, accessing those links, please contact me and I'll get you squared away. All responses, whether they're negative, positive, or if they just not answered, will display in the provider section. All assessments, all 3 forms are presented with automated secondary screenings for the deployers. The secondary screening outcomes, including the scores, which we mentioned in those data matrices for the PTSD, alcohol consumption, physical symptoms, and depression, they'll calculate scores for you and place them in a risk category. And of course, the automated summary, the copy and paste function functionality, copy and paste function the copy and paste functionality for the ALTA Encounter is also new with the new forms. And I'll actually go in there and I'll demonstrate that when we get to it. And just in case you have any questions here, I got all the emails for all the people that can pretty much answer any questions you have. Mr. Philip Patronella, who's the big boss over here, he's our program manager. Mr. Dave Cody, he works on the PDHRA program, as well as myself and Miss Brenda Patterson. So all 3 of our emails will be in the PowerPoint. So if you have any questions, feel free to contact any of us at any time. So were there any questions before we actually go into the hands-on demo in MHA? Dr. J, go ahead.
Read it.
Well, this is. So it says, now that we have more experience with the DD2796, I can mention the following. I would like to know how other providers' experience is. The comments box 21 takes only 250 characters, and when it prints into the SF600, it stops at 250 characters. To overcome this, we are doing the following. When there is a clear break of thought in 21, we are continuing in block 22. At least we have continuity, and the next provider can actually see and understand what our thought process was.
This is Phil Patronella here at OTSG. based on the guidance from Colonel Belinsky, who is the chief of medical readiness and standards here, and I think this is something he's put out to the DCCSs in their meeting. The assessment is meant to be just that, an assessment. If there's extensive documentation of notes, it should be done in the soldier's record. And so the intent is to capture just those comments that need to be captured in reference to the assessment at that time. And any additional extensive notes that need to be made on the soldier should probably be captured, should definitely be captured in the soldier's medical record. This was a form that was designed by the by Health Affairs, and there's only so many characters they can receive when we transfer the data over to the Armed Forces Health Surveillance Center. So I mean, we can make the block, you know, as long as we want to do make it, but it doesn't necessarily transfer anywhere, and you're just going to cut off at a certain point. So we definitely need to try to make sure that we're documenting extensive soldier notes in the soldier's medical record. Any questions on that?
All right, so if there are no more questions with that, what I'm going to do now is I'm going to pull up MHA here and go ahead and do the hands-on demo. I think most of you are familiar with MHA, have probably already seen it, so what I'm doing is just entering my test SSN here, and I'm going to pull up the form so we can go through the healthcare provider tab. Okay, so I'm logged in. One thing I do want to point out for those that haven't seen it, you'll see this little tab right here. It says DHA 2012 training material. So as soon as you log in and you're about to access one of the DHA forms, there's 3 different links here with all the updated information and some of the training slides and everything that we'll be going over today, or that we have went over today. So there's 3 different links here. You can pull these up. Okay, so I'm going to be pulling up the PDHRA, the TD 2900. As you see here, I got a form here, it's provider portion not completed, so the deployer went through, completed his portion, and now as a provider, which I'm acting on right now, I got to go through and I got to sign the form. So we're going to be doing mocking the assessment or the interview with the deployer. Alright, so I got it pulled up. We're actually on the healthcare provider portion of the tab. One of the things I do want to pull up here at the top, you'll see where it says deployer most recent deployment was to Afghanistan, has deployed 3 times before in the past 5 years. This is one of the first questions asked on the deployer portion of the form when they're filling it out and they complete their personnel information. It asks them what was their last deployment to and how many times they've deployed in the last 5 years. So that's one of the first questions they ask, and that's actually populated here at the top of the HCP tab, so you can see it's provider before you start going through with your assessment. We're starting on questions 1, and one thing I do want to point out, you'll notice that the question 1 right here for the deployer, for the provider, is questions 1 and 2, and it lets you know that the deployer's questions covered on question 1 are 1 and 2. So if you just highlight your mouse over where the yellow numbers are, and if you click there, it'll hold up, and basically what this is going to display the question that the deployer was given, and their response. And their response is already always highlighted in red text. And if they do have a positive response, you'll see here, this is covering questions 1 and 2. It's going to highlight in yellow, just like I mentioned when we were going through the PowerPoint. And it's going to let you know the deployer indicated concern. So if we look at the question, question 1 is, overall, how would you rate your health during the past months? Deployer answered poor, indicated a positive response. It's letting us know that a deployer indicated a concern, and the system is mandating that the provider leave a comment because it was a positive response. And that's why it's yellow. So all we got to do in here is just go in here and leave a comment. I'm just going to write the word comment here. And you'll notice that as soon as you leave a comment, that yellow highlighting in that provider comments box will be removed, and you've met that action required. And if you leave any of these yellow boxes in here, that are highlighted yellow, meaning that they need provider action taken. If you leave them yellow, when you go to sign the form, it'll instruct you to go back and leave a comment or indicate a referral, whatever the case may be, before you can actually go in and sign the form. So basically anything yellow you see needs your action as a provider. And question 2, we hover our mouse over that. It's asking us, compared to your most recent deployment, how would you rate your health in general now? The answer by that deployer was much better now than before I deployed. So as I mentioned in the PowerPoint, that is a negative response. So we got an NA and deployer's response box here. So the provider does not need to leave a comment. It's not mandatory. We'll move to question 2. And what I want to do is I want to go over all these questions that we have on the HCP tab. That way you can understand the logic and the functionality of it, and that way we can go ahead and I can show you how when all the positive responses are indicated, we can leave the response and we can move on to the next question. So number 2 for the provider touches down on question 3 for the deployer, and it's asking were you wounded, injured, or assaulted, otherwise hurt during your deployment? Since there was a positive response, is in yes. 2A has a yes populated, and so 2B is indicating that you need a referral. You need to indicate a referral. Because on 3A it says if yes, or if you're still having problems related to the event, yes, that's what's populated. It says if yes, please explain, and you'll get a free text box right here that's indicated by the deployer, and this deployer mentioned that he hurt his back lifting heavy equipment. So as a provider, we got a positive response. The deployer still having issues, so we need to indicate a referral. And on questions 2B, you have 2 options here. You can say yes, you want to indicate a referral, and what's going to happen is when you get to boxes 16 and 17, you can indicate the type of referral for this issue, or if you select no, which I'm going to go ahead and select just so you can see the follow-up boxes here, it's going to ask why that you want to refer for evaluation, indicate a referral. So you've got 4 choices here: already under care, already has a referral, no significant impairment, or other reason. And if we click other reason, you have to leave a comment why. So you can go ahead and make one of these other the choices here: no significant impairment, already has a referral, or already under care. And if you do that, you won't have to leave a follow-up comment, but if you have other reason, you'll have to explain why. The next question we have for referral, I'll go ahead and indicate a referral. That way when we get to block 16 and 17, I can show you how the functionality works for those of you who haven't seen it. Alright, so question 3 for the provider answers questions 4 for the deployer. It's asking 4A, 4B, and 4C. Did you ever feel like you were in great danger of being killed? Answer for that deployer was yes. As you can see, the provider comments box is highlighted in yellow. 4B is asking, did you encounter dead bodies or see people killed or wounded? That answer was yes. And 4C was, did you engage in direct combat where you discharged a weapon? That answer was yes. So we did have a positive responses on 4A, 4B, and 4C for the deployer, which is question 3 for the provider. So we need to go in there and leave comments in each one of these provider comments boxes, or the system will not let us sign the form. And you'll see on deployer's response here, and each one of those drop downs is letting you know, it's indicating that you did have a yes response, in addition to those provider comments boxes being highlighted in yellow. And question 4 for the provider here covers down on questions 5, 6, and 7. I'll go ahead and hover my mouse over here. 5, 6, and 7 for deployer. And this is basically asking about the healthcare provider visits. On question 5, the deployer indicated that he had 4 to 5 visits. And you can see on the deployer's response or concern, it's indicating he had 4 to 5 visits, which is a positive response. Therefore, we got to leave a mandatory comment in here. Question 6 says, asks, since you returned from deployment, have you been hospitalized? The deployer answered yes, so they got a follow-up additional question. It says, if yes, please list date and brief details. Okay, so since we did have free text and that was a positive response, it's letting you know that 6 indicated a concern for deployer, and it's letting you know that 6A right here, the free text, what the issue was, back spasms, is going to be listed under the deployer's response or concern. So as I mentioned in the PowerPoint, any of that free text is going to be displayed in the deployer's response or concern box when they indicate that it is a positive response. So once again, we need to go in here and leave our comments because it was a positive response. We got to see the text from the deployer, and we're good to go. Now on question 7, it's asking, during the past month, how difficult have physical health problems, illness or injury, made it for you to do your work or other regular daily activities? Deployer indicated, not difficult at all. That is a negative response. And so you can see in the deployer's response to concern, it says NA. Okay, and we're not highlighted in yellow, so we're not mandatory for us to leave a comment. On question 5, is there any question? I feel like I'm going kind of fast. Is there any questions from anybody before I jump on to question 5? Anytime. So the question from Mr. Bob Berger, I apologize if I said your name wrong. Would typing CSF600 suffice in those blocks?
Going back to the same issue about the text. Still doesn't.
Still 250.
It still limits you to 250 characters. So, I mean, I'm not sure exactly why you would want to do that. Again, if the intent is to do extensive capturing notes, extensive notes in the record, then we suggest that you.
Hi, this is Major James. I think that typing SF600 is not sufficient enough because the soldier may not have that record with him. And if this may be an altered document, if the soldier goes somewhere else, you can always look at the altered document and see that MedPro's, whatever you type, is going to show up in that alter note. So I think saying see the SF600, the soldier may not have it all with them. Surely we can summarize it into summarize it.
Rod, thank you, Major James, for that. I mean, that's the intent, to make sure that if we're going to do, you want to capture notes that you want to pass on done in the soldier's medical record.
Roger that. All right, so we're on question 5 for the provider, which covers the questions 8A through 8DD for the deployer. And basically, these are the questions with that matrix that I mentioned in the PowerPoint with the physical symptoms scale, with bothered a little, bothered a lot, not bothered at all. So once again, if we hover our mouse over those numbers, we're able to see the questions with all the responses given by the deployer. So in this case, you get to see all the physical symptoms with bothered a little, bothered a lot, not bothered at all. And it does it through all 3 of these different question formats here. Okay. And what's going to happen is, what the system's going to do is going to go ahead and it's going to categorize. It's going to list all the symptoms that the deployer was bothered a lot by in this top column. And it's going to go ahead and list all the symptoms the deployer was bothered a little by in the secondary column. And the symptoms that were not bothered at all, they don't mention those. And let's go ahead and calculate. It's using the point system here to calculate the severity, and it's going to list them in that risk column that I mentioned earlier. So in this case, this deployer actually answered bothered a lot by most of these questions here. So they got a PHQ-15 score of 15, which is high. So they're in a high risk category. So question 5A is asking, does the deployer have evidence of high generalized post-deployment physical symptoms? Basically, they do. They answered 15, or they scored a 15 on that scale. So we're going to say yes. This is based on deployer's responses to deployer questions 8 through 8DD is a referral indicated. And that was question 5B. So since we did have yes, they did score high on the matrix there for physical symptoms, we're going to go ahead and say yes, we're indicating a referral. And once again, if we would have said no, we would have got the same choices and options as the first referral indicator that we went by. And of course, if you hit other reason, you'd have to leave comments in there. So I'm just going to hit yes. All right, we're moving on to question 6 here, and this gets into the getting closer to the depression questions. So 6 is asking major life stressors reported on deployer question 9. So question 6 for the provider is covered on question 9 for the deployer. So it's asking the deployer over the past month, what major life stressors have you experienced that are a cause of significant concern or make it difficult for you to do your work, take care of things at home, or get along with other people? If the answer was yes, they wanted to go ahead and please list and explain. The deployer did answer yes to that question as a positive response. So in addition to 9A, you got free text that says not getting along with my family. It's in the red text here. So that was the deployer's concern, which is populated in the box in 6A. So since it was a positive response and they did answer yes to that, 6B is asking, if yes, ask additional questions to determine the level of the problem. So it's indicating you as a provider to go ahead and get more information on that deployer's concern. This is a highlighted box here in yellow, so it is mandatory that you leave comments in here. So once we do that, we can move on to the 6C, and it's asking if we want to, once again, consider this soldier for a referral, and I'll go ahead and I'll click yes. All right, moving to question 7. Question 7 for the provider covers down on questions 10 and 11 for the deployer. So question 10 is asking the deployer, in the past year, did you receive care for any mental health condition or concern such as, but not limited to, post-traumatic stress, PTSD, depression, anxiety disorder, alcohol abuse, or substance abuse? Deployer answered no, gave a negative response on question 10. So as you can see here in this first box, we got that NA showing up in deployer response. It's not yellow since it's not a positive response, so as a provider we don't need to leave a comment. And question 11 is asking us, what prescription or over-the-counter medications for sleep, pain, combat stress, or mental health problems are you currently taking? So the deployer actually did list he's taking extra strength Advil. So we got a positive response to deployer answer, and we're pushing over the free text on the deployer's response. So since we do get a positive response, we need to leave comments. Just remember, for the providers that are still new and have been working on these forms for quite a bit now, when everything's yellow, that's basically where you need to take action. All right, we're moving to question 8, and this is where the alcohol consumption questions come in. So question 8 covers down on question 12 for the deployer. So question 12 is asking, how often do you have a drink containing alcohol? Deployer answered 4 or more times a week. How many drinks containing alcohol do you have on a typical day? Deployer answered 10 or more. And how often do you have 6 or more drinks on one occasion? Deployer answered daily or almost daily. So what I did here is I wanted to make sure that we maxed out and we had a positive response on all 3 of these. That way we could make sure that we got an Audit C screening score. Okay, so based on the number of drinks he has on occasion and through the week, his Audit C screening score was 12. So since he did answer positive, this is considered a positive response. The system's asking you to ask that deployer, how many drinks does he have per week? And how many drinks does he have per occasion? So you need to make sure you fill that in. And it only takes numerical text. I just want to point that out. You also got a choice here. You'll see this box circling around here. It says not answered by deployer. One thing I do want to point out on the deployer portion of the form is that deployer can actually purposely skip over questions when filling out their portion of the form. What the system will do is if they skip over a question, they'll get a pop-up box that'll ask them, are you sure you have skipped questions? Are you sure you want to proceed? And they actually have to select yes to go on to for the additional page. Now the deployer has the ability to skip over any questions that they want to skip over. And it is going to ask them if they purposely want to skip over those questions. So when you're doing your assessment and you're doing the sit down with that deployer, it's going to signify any of the questions as not answered if they went ahead and skipped over those questions. So it's going to let you know as a provider when that deployer purposely skipped over a question. Remember, we were going through it before. It's going to say not answered. So they do have the ability to go through and not answer questions. And as long as they get to the last question, they submit it, you can have blank questions in here. And then when you're sitting down and you're doing your assessment and they still don't answer those questions, you can actually hit not answered by deployer and you're able to move to a different section. Okay, I just want to point that out. We get questions on that sometimes. Okay, once again on the alcohol use intervention matrix, we got another table here that's going to go ahead and place that soldier in a severity category. Once again, his Audit C screening score was 12. So the Audit C score for men and women above 8, which is the most severe, indicates that they need to refer for referral or conduct brief counseling. And since they did have a positive response, 8B, once again, wants you to indicate a referral. If we select yes, we got to indicate that on blocks 16 and 17. This moves us to number 9, question 9 for the provider, which covers down on questions 13 for the deployer. These are the PTSD screening questions. Okay, so if I hover my mouse over here, I get to see 13A, 13D. It's asking about nightmares. The deployer answered yes. It's asking us asking the deployer if he tried hard not to think about it or went out of the way to avoid situations that remind him of it. Answer was yes. Was the deployer constantly on guard, watchful, or easily started? Yes. And 13D, the last question, was the deployer felt numb or detached from others, activities, or surroundings. So the deployer answered yes on all 4 of these PTSD screening questions. And it's asking if the deployer marked yes on 2 more of the questions on the provider tab here. Since we selected yes, we're getting it's going to prompt that soldier or that deployer to go through and answer the secondary screening questions. And that's basically 13E through 13V. And based on these questions, you're going to go ahead and you're going to get that PCLC score. In this case, the deployer scored an 80 because he pretty much answered positive to all those questions on the additional screening questions for 13. And once again, you're going to have a matrix here, so you can go ahead and place that deployer into a severity column. So if they have a PCLC score of higher than 50, then they're the most severe column here. Is there a question? And once again, can we have asked that everybody mute their phone? I'm getting a little feedback. Appreciate it. And I did have a question here from Ms. Jackie Smith. She's asking, can the medic doing pre-screening clarify the soldier's answer? Deployed as a medic, I went through the unit's PDHA prior to the provider, and it saved the provider time from explaining the question on the form. The soldier was confused and answered incorrectly. They're basically asking when I'm guessing, Jackie, that when a soldier answers, gives a response on the form, whether it be I'm guessing it's going to be positive response, that the provider can go in and clarify that positive response and get more information.
You need the face-to-face with the provider. I'm not sure if I understand your question correctly, Jackie, but I think any clarification that will be, or a discussion on that will be when the soldier sits down with the provider, that they can actually either correct their responses, or they can clarify their answers at that point.
Form in general, we went through the soldier's form and corrected their answers.
I don't think there's the ability for them to do that now on this form.
You can leave comments based on whatever the positive responses are, but you can't go back and change or
For the soldier's answers.
yeah. Questions and follow up on that?
I have none.
Okay, once again on question 9, if that deployer choose not to answer those questions and do the additional screening questions on 13E through 13V, you have an option here to go ahead and select that, stating that those questions were incomplete. Okay, and so if they didn't answer all those questions and they skipped over, let's say that they answered negative to the initial questions, you won't get a PCLC score here because they didn't do the follow-up questions. Or if they answered positive to the initial questions, and when they're doing the additional screening questions, if they don't answer all of them and they skip over some of them, the system, since there are incomplete questions on here, it won't be able to compute that PCLC score. So I just want to throw that out there. I've gotten calls from providers saying that the deployer answered positive to on 13A through 13D, but when they went through the additional screening questions, they left some of them blank, and they were wondering why they didn't get a PCLC score. That's because the soldier or the deployer has to go through and answer all those additional screening questions before the system can be able to compute the severity score for you. Okay, since we did have a positive response, it's asking if we got a referral indicated. Once again, it's the same questions here, so I'm just going to choose yes. And once we get to block 16 and 17, I'll go ahead and show you how that logic works with indicating multiple referrals. So now we're moving to question 10. This covers down on the depression questions here. 10A is asking, and I'm sorry, questions 10 cover questions 14 for the deployer. And it's asking, did deployer mark more than half the days or nearly every day on questions 14A through 14B? So when we pull this up, we're seeing that on questions 14, little interest or pleasure in doing things was answered nearly every day, and if you're feeling down, depressed, or hopeless, nearly every day. So we did get a positive response, and the answer was yes. He did answer more than half the days or nearly every day on either of those questions. So since we answered positive to the initial question, it's bringing us to the additional screening questions here. which are basically 14C through 14I. And this is where they can go in and give the response of nearly every day or more than half the days, which is what the system is looking for to compute the and the matrix for the severity score. So you can hover your mouse, you can see all those. And what the system is going to do is, based on the responses there, it's going to compute the total and place them in a category. So the PHQ 8 score for the depression questions equal 22 based on 14C through 14I. So if we look at the table, PHQ score of 19 through 24 is indicated on the severe symptoms, so they do fall in the worst category here. Once again, you also have the option that the deployer did not want to answer the additional screening questions. You can go ahead and mark this box right here that lets you know that the answers were incomplete or not answered. Okay, so these tables pretty much work the same on all the matrices. It'll compute the score from the additional screening questions based on the positive responses, and then it just kind of gives you the category where they fit in, and it's just there to guide the provider and the treatment of that deployer. And following each one of these tables, it's always going to ask you if a referral is indicated, and if it is a positive response, we got to go ahead and we got to choose yes or no. Okay, now we're on question 11 for the provider, which covers down on questions 15 for the deployer. And these are the environmental exposure concerns. So the deployer is asked on question 15, are you worried about your health because you believe you were exposed to something in the environment while deployed? So if that deployer would have answered no there, he had no issues, you'll see that this options box here with all the options for the exposure concerns would not be highlighted. But since he did say yes, it's asking him the additional follow-up question. If yes, please explain. Deployer answers, I was exposed to smoke from the burn pits. So that was his concern. So as a provider, you can go in here, and I think there's actually one right here that says smoke from burning trash or feces, smoke from oil fire, tent heater smoke. So based on that deployer's response to the exposure concerns, you can go in here and mark as many exposure concerns as you need. And at the very bottom, there's other exposures to toxic chemicals and materials. Basically a comments box in here. It acts the same as a comments box. And you can actually go in here and fill this in for any additional exposures that we don't have listed as an option here. You can do that in addition to any ones that you want to mark that's already there. Okay, and once again, that covers down on question 15. That's just the environmental concerns portion. Since we did answer positive, there was a positive response. Once again, we're asked for a referral. That brings us to the rabies risk questions, number 12. So number 12 for the provider covers down on question 16 for the deployer. So they're basically asking the deployer, were you bitten or scratched by an animal during your deployment? Deployer said yes. As you can see in 12A, we got a yes response. And they're asking for the deployer to explain. If yes, please explain what kind of animal is involved, your injury, and what happened. The deployer indicated he was scratched by a cat. And 16B, it's asking, were you exposed to animal saliva or secretions during your deployment? I do want to emphasize this question, 16B. This question is specific to the Army forms. This is not on the Air Force's deployment health assessment forms or the Navy. This is specific to the Army. So 16B is not on any of the other forms. So they're depending on whether they answered for yes, I went ahead and answered no, or the deployer answered no. So it says if yes, please explain. We leave that one blank. So since the deployer did answer yes to the bite or scratch, it's asking us to go ahead and choose whether we want to do a follow-up referral. And if we go ahead and select no on this one, I do want to point out it's going to ask if they were exposed to a animal bite or animal scratch. Your options are: were they appropriately treated? Were they already under care? Did they already have a referral? Was the situation not a risk for rabies, or other reason explained? So we go ahead and indicate that he was already under care. So the options are a little bit different for the referral for the animal bites, rabies risks. So I just wanted to show those to you on the drop down. It's not the same as all the other referral indicators. Question 13 covers down on suicide risk evaluation. These don't show up on the provider portion. I'm sorry, on the deployer portion of the form. These are questions that the provider is supposed to ask during the sit down, during the assessment, the interview with the deployer. So it's basically going to prompt you to ask the deployer these questions, and it actually says it, ask, and I have in parentheses the question you're supposed to ask. So it's asking, over the past month, have you been bothered by thoughts that you would be better off dead or hurting yourself in some way? And you'll see that in these questions, whether regarding the choice that you make here, so if we select yes, it's going to have you go further on the 13B through 13D. But if we select no, we can go to block 14. But just so we can go through the questions real quick, I'll go ahead and select yes. And like I said, if we go ahead and select yes, that's our initial positive response, and we're going to have the additional screening questions. So 13B is asking if 13A was yes, how often have you been bothered by these thoughts? And then you'll see that familiar, few or several days, more than half the time, nearly every day. So if we say more than half the time, it's going to ask us for 13C, asking if 13A was yes, have you had thoughts of actually hurting yourself? So let's say if we said yes on that one. You'll see that 13D through 13G just opened up for us. Okay, so it's asking you as a provider to ask that deployer, have you thought about how you might actually hurt yourself? So if we said yes, it's going to ask how. If it's going to ask how, they want the deployer to give you that response. You're going to type that in. 13E's asking the provider to ask that deployer. There's a big difference between having a thought and acting on a thought. How likely do you think it is that you would actually act on these thoughts about hurting yourself or ending your life over the next month? They're given 3 choices here. Not likely at all, somewhat likely, or very likely. 13F, like I said, if there's a positive response, you're going to have to go through all these and make sure that you indicate them. They're going to show up yellow. So if you skip any of these, if there's a positive response, it won't let you sign the form. So it's asking, is there anything that would prevent you from harming yourself? If we select yes, you see that the what box right here, so they want additional information. And 13G is asking, have you ever attempted to harm yourself in the past? Once again, you're getting a yes or no answer. And say if we say yes to that one, once again, it's going to ask how. You would gather that information from the deployer. And once again, since these are positive responses, we have to fill those comments boxes out. 13H here, it's a free comments box. If there's further risk assessment that you need to make as a provider, if there are questions on here that you need to ask that wasn't supplied to you with 13A through 13H, you can go ahead and document those questions along with the the deployer responses in this comments box. And the last question on the suicide prevention here asks, does the deployer pose a current risk for harm or to self? So depending on what you select here, if you say yes, it's going to want you to indicate a referral, and if you say no, it can move you on to question 14. Okay, and 14 covers on the violence, harm, risk evaluation. These are also questions that aren't provided on the deployer portion of the form. These are the face-to-face questions. I want you to ask that deployer, over the past month, have you had thoughts or concerns that you might hurt or lose control with someone? Acts the same way as the suicide risk question. So if we say no, we go to block 15. We go to yes, we need to leave comments. As soon as we leave our comments, the yellow highlight goes away and we can actually move on. Does member pose a current risk to self or others? So if we say yes, block 16, 17, no, got to state a reason. Once again, as soon as you leave your comments in here for whatever the responses for the provider, from the deployer, you are good to go. You can move on. Now this brings us to question 15 here, deployer issues with this assessment. Like I said before, the deployer, when they're going through the form, they have the ability to go over and skip over questions. I mean, the system's going to ask you basically, are you sure you want to skip questions? And they have to purposely select yes before they get to the end of the form, and they actually have to submit the form. So if there are any questions that were skipped by that deployer on the form, and they decline to answer the questions during your assessment as the provider when you're doing the face-to-face, they still decline to answer any of those questions, you can actually select deployer decline to complete form or deployer decline to complete interview or assessment. So you do have the option over here. It's on question 15. I want to throw that out there. So questions, block 16 and 17, these are the referral blocks. So basically, on the previous questions that we answered, if we had positive responses and then we had that referral indicator question afterward, if we indicated that we did want to indicate a referral for any of those positive responses, block 16 and 17 was where we go ahead and describe what type of referral we want to indicate. So you at least have to make one selection. So let's say if I wanted to, I'll choose physical health. So as soon as you do that, you'll see that the mandatory action here is at least select one referral if you did select yes to one of the referral indicator questions. So as soon as you do that on block 16, it's going to bring you to block 17. These are the recommended referrals, and you can mark all that apply. So all you need to do is go down to these drop downs, and you're given 3 choices here: 24 hours, within 24 hours, within 7 days, within 30 days. Okay, and like I said, you can do multiple referrals. Pick as many as you need. But the minimum, the mandatory, if you did select yes to a referral indicator, is just one referral. Okay, that's 16 and 17. What we're going to do is go down to question 19 for the deployer. Actually, before I do that, let me cut down on question 18 here. 18 is another comments box. This is a free text comments box, so if there are any additional questions that have to do with referrals, the suicide risk, depression, anything, you have a free comments box where you can indicate anything that you please. It's not highlighted yellow because it's a free text box. It's just there if you need it. Questions 19 for the provider covers down on question 17 through 20 for the deployer. And as you can see, all 4 of these questions here were positive responses. So you'll see over here, you'll have a yes response in each one of the deployer concern boxes here. And of course, the provider's comments boxes are yellow, indicating that you need to leave comments here. Once we do that, basically it's based upon their response, of course. We met that the mandatory action of leaving the comment. It's no longer highlighted yellow, and you can move on to the next question. The logic pretty much works the same. If you see anything yellow as a provider, go in there, leave your comments, take the action needed, indicate the referral, and it'll remove that yellow highlight, and you can go to the next question, and it'll let you sign the form. Question 20 here covers down on supplemental services recommended. Here, these are just boxes. If you want to actually indicate that you need appointment assistance, chaplain, health education information, healthcare benefits, resources information, you can indicate these. And you also got an others list right here that you can list if you need it. And below that, we have our behavioral health section. This is optional. If you do have a behavioral health specialist or behavioral health provider that would like to leave comments in here, they can. However, the behavioral health comments box here, the specialist needs to leave comments before the provider signs off on the form. Because as a provider, once you sign on this form, you sign off on it and it's completed, the form is locked. It's in completed status, and that behavioral health specialist will not be able to go in there and leave comments. And they need to do that before you as the provider, healthcare provider, goes in and signs the form. And at the signature block here for the provider, all you need to do is click I certify that I've read the guidelines above and am a valid provider. You enter in your title here. Like I said, I'm in the system right now as a provider just to do this demo. So I certify this form as Chad Valentine, and of course if you're a provider, have your name. All you'd have to do is say I certify this form. What's going to happen is you're going to get a pop-up, and the system is going to ask you if you'd like to go ahead and proceed and complete a abbreviated PHA. If not, all you have to do is hit cancel. And what's going to happen is you're going to get that clipboard with the documentation for Alta that I spoke of earlier. It's going to ask if you want to go ahead and take all this this web page and allow it to copy and paste to your clipboard. Just say yes, and you're going to get a message from the web page saying that all the text was copied to the clipboard. And you just click OK. So all you would have to do, now I just opened up a Word document, so I'm pretending I'm in Alta right now, is just hit right click and paste. And what's going to happen is it's going to take all those questions from the deploy portion of the form along with their responses, and it's going to paste it wherever you need to go in Alta. You can hit right click paste, or you can hit Control V. So it's going to list all that information, and here at the bottom, let's see here, it's going to let you know the provider's signature, it's going to give you a provider's title, it's going to give you the date and provider's name as well. So this is what it looks like with the copy and paste. And like I said, I'm not super familiar with Alta. I don't have access to that application. But when you have an Alta encounter, you have the Alta application open, wherever you guys need to go, the providers go, you just go in there and just paste it in there. It's already copied for you. Were there any questions? Okay, so we had a question here from Dr. J in the chat box. It says, in the older version of the 2796, behavioral health answers were confidential and were removed when you got a printout or when you signed and submitted. In the new version, all the BH answers are visible. Comments box, you know, I haven't even seen that when I printed it out. Dr. J, you're on the line. I'll get with you after the training. Because off the top of my head, I can't remember what prints out with the behavioral health comments. We really don't print out a lot of the forms over here. No, Brenda's not. Another question was asked, Phil, has there been any discussion about linking the referrals directly to translate into Alta?
Well, that's a separate initiative. I think there is a MHS level work order that we worked about a year and a half ago to actually do that. But that'll be a separate task that we have not really gotten any indication of when that will be completed. But that's an MHS level action that all of the services are dealing with right now. So linking those referrals to Alta is not something that we approach with this initiative here. But it is something that all of the services are looking at. Yes, right.
Oh, Gabe Chasen asked, what does SDFSD mean? When I was filling out this form, I was just trying to get through it in some of the free text fields, and I just was typing anything in. It was just it was a test form. So were there any more questions on the healthcare provider portion? Because what I'd like to do now is okay, so Dr. J had another question here. It says, another question, in pre-deployment DD2795, if you've made a service member no-go for a simple reason like lipid panel or EKG, etc., when the SM returns and the problem is cleared, we have to complete all the questions from the beginning. Is there any way to give the option to edit our previous answers? So I guess my question is this after you've already signed the form? Or would this be while you have an open form? So you've already signed the form? You'd have to edit. Yeah, it's locked. You'd have to edit and re-sign. So when you do edit and re-sign, I'm unsure if you guys do that. What'll happen is it'll populate all the deployer's answers will still be on the form, but all your responses will be removed. So Brian is asking, so it's still a manual process. Are all providers aware they need to complete the referral process?
At the SRP sites, right, or maybe someone from the one of the SRP sites can chime in on this, but the referrals are usually done manually at the sites and track them through completion.
Brian, if you'd like to dial in and add anything to the discussion, we welcome him.
There is a module within MODS that we worked on a couple years ago, rudimentary, but you can use that for tracking referrals. Provides you with the type way to actually capture those who were referred. so Brian, we probably need to have a separate discussion offline. You've worked and we work in our end. Soon again.
Okay, yeah, I just dialed in, sorry. I just kind of wanted to clear that piece up because it has been an issue. We've been tracking PDHA, PDHRA for almost 3 years. Dave Cote's on the line. Him and I became very close with each other, and that's really what we were finding. We were finding that they weren't going over and doing the manual process because they really weren't aware of it, and then two, if they were aware of it, they'd go and they'd do the manual process, and then the soldier wouldn't know that they had a referral, so the soldier wasn't going to their referral. I've been running a metric. I've been running several metrics for the last couple of years that really, they go in and they just really do a pretty simple check in the CAPER record to see if after the date of the event that soldier followed up in any of the clinics that were indicated on the PDHA or the compliance process or the compliance percentage has been relatively low. I would say under 50-60% soldier following up based on the referral indicated. I just kind of wanted to get that out there.
Yeah.
So we can still continue to talk about this offline, but I wanted to make that aware of that.
Yeah, thanks for sharing that, Brian. I mean, there's some. And it was actually, I think, all of the services are struggling with this.
Well, and that's kind of the reason why I'm getting it out there is because when we do the PDHAs and we do the PDHRAs and we do indicate that it's a referral, particularly for behavioral health, and they put on there that the soldier's a priority 1 or a priority 0, and then they're not saying, hey, Private Snuffy, you are indicated for a referral to behavioral health, and we feel you need to be seen within 24 hours. Is there follow-up being done with that? And that's really kind of, I understand that there's been dialogue in the last couple of years. However, I think we're kind of spinning our wheels when we do PDHAs and PDHRAs, and then we're not following up on the referrals. And I know that this is not something that you guys have control over, but I just wanted to get that out there, especially if there's a large provider audience in this DCO, that is definitely an issue that's out there.
Okay.
Thanks.
Like there was another question here, Phil. That's another question about the 250 character limit. Everything needs to be documented.
Yeah, once again, I'm not sure if that person was online when we discussed this earlier, but the intent is not to do all your documentation on the assessment. It is again an assessment, and any extensive documentation would require for you to put that.
Okay, one last thing I wanted to touch on was one of the added functionality with the new forms. So what I did was I went back into MHA here, and what I want to pull up is that when a deployer goes through and starts working or begins one of the health assessments and they do not complete it, okay, so they exit out of the form before they complete it, what's going to happen is on the status in MHA, it's going to actually give you the status of member portion not completed. So when you are your provider and you're sitting with a deployer who had not completed his form, we've gotten the added functionality here and allowing you to go into the form to complete it as well. So if you click on edit form, you'll see at the top here, if the survey is unfinished, if they do have a form that they did not complete, it's going to let you know the survey is unfinished. Please click here to continue the survey. So this allows you as a provider, when you do have that deployer that comes in and maybe he didn't do the last 2 questions, or maybe he went halfway through it and wasn't able to complete it, it gives you ability to sit down and complete that form with the deployer. I just want to show you what that looks like here. So all I did was click at the very top where it said this survey is unfinished. Please click here to complete the survey. So when we click in there, what's going to happen is it's going to bring us back into the member portion of the form. So it's going to take you as a provider into the form wherever that deployer left off at. So in this case, it is at the very beginning of the form. But you're able to go in here and complete all the questions on the form with the deployer, and you can actually submit it. So I just wanted to show you that you do have that added capability here. Whenever that deployer, remember, if that deployer goes through the form, doesn't get to that last question, and then exits out of the form like I just did, it's gonna track the status of that form as incomplete, and it's gonna be member portion not completed once you look that form up in MHA. So at the very top, whenever you have those forms, it does allow the provider to go in and complete that survey along with the soldier. Wanted to just point that out. Were there any questions with the healthcare provider portion of the tab, documentation Alta, anything that we discussed on the PowerPoint, or the added functionality of being able to complete the member portion of the form with the soldier? Is there anything that anybody needs me to go a little further in detail with?
Hey Chad, this is Audrey. You might just want to mention the deleting the incomplete forms capability. I know I've addressed a couple of emails from providers out there as to who can delete those incomplete forms.
Roger. So you do have the ability to delete the incomplete forms. It's at the RMC level, the providers, and the soldier's able to go in and delete his forms through the AKO My Medical Readiness. So in here, I got the screen pulled up now. Was there a question?
Oh, you can answer that first.
Oh, they're not able to hear me in the mic?
No, that's
Oh, okay.
they hear you.
Okay, so what I'm doing here, I just wanted to go ahead and demonstrate that, what Audrey was talking about. You do have the ability to go in and delete these incomplete forms. So when you do have incomplete form, there's a button here that says delete incomplete. It's asking, are you sure you wish to delete this record permanently? And just click yes. I did get a question. Can the provider place the assessment on hold in the event we would like the behavioral health to assess a point prior to signing?
That's a patient, I think.
Oh, patient. Oh, you can't place a form on hold. What the provider can do is it's going to be in provider portion not completed status until the provider actually goes through and signs the form. So if they sign the form, it's complete, it's locked. So if they need a behavioral health specialist to go in there and make comments or assess the soldier's responses, they would have to do that before the provider signs it. There is no hold. Sorry. Read the post of the reassessment. It's only when they sign. They got to. I'm talking to you. Yeah, they have to sign the forms. The providers, when you actually go in there and you sign the forms, that's when it gives you that pop-up to where you can go in and copy and paste into Alta. Just want to throw that out there. It should happen automatically for you. Were there any more questions? So I got another question. So can you save the form for the behavioral health profession, that specialist, to review, and provider, thank you, for the behavioral health provider to review, and you don't lose any information on the form? Once again, yeah, we don't have, it doesn't have the functionality for you to save the form. It's basically either in incomplete or complete status, meaning it's either signed or it's still an open status for the provider to go on and complete that assessment. We had another question. But we identify behavior health patients during the provider assessment. What you are saying is that the entire process is repeated if behavioral health gets involved.
Form. If they sign the form, then behavioral person cannot come in at that time and sign it.
During the provider assessment. I guess, Mr. Bob Berger, an incident like that, as long as you could fill out your portion of the form, but as long as you didn't sign it, I mean, yeah, they can see it. I mean, I don't know how long that process takes, if that's something that, they come and see them right before you do or right after, or if it's days apart. But if you're completing that assessment with the deployer, you can leave that form open, and I guess they can complete theirs. I don't know the time differentiation between when the behavioral health specialist sees the deployer before or after the provider does.
Hi, this is Major. Here at Camp Shelby, Medical Task Force Shelby here in Mississippi, we, as the providers, just go ahead on and complete the form and identify behavioral health issues, and then we just send that soldier straight over to behavioral health for a consult. And then when they come back, they have a note in ALTA from behavioral health. They have a note in ALTA from the case management. If they're clear, then we make them a go. Other than that, it's all handled through case management. So, note in ALTA, which I think is a little bit more better than having them to stop and come and do the 2796. I mean, you would be holding up that chart for over here days. So we just don't do that route.
Okay, she answered that question.
Thank you, Major James. And I think that's probably, I was just going to ask you to chime in on that, because you're correct. I mean, there's no telling how long that form would stay open if you were waiting for behavioral health to see the soldier. So I think it's based all on your work processes at your location. But I think that sounds like a more feasible solution.
Hey, Phil, this is Audrey. I can like to make a comment on that. That capability was built into the deployment health assessments for those locations who do have behavioral health facilities actually in conjunction with the pre and the post-deployment process. Not all locations have behavioral health providers or specialists on site, and they do pretty much the same thing that you do there at Camp Shelby, ma'am. But for those locations who do have behavioral health on site, they generally have the soldiers go through the behavioral health provider first, and then the healthcare provider who's ultimately going to sign off on the form would then go through and do the remainder of the behavioral health information. Excuse me, the remainder of the healthcare provider tab.
Yeah. Hey, thanks for clarifying that too, Audrey. Yes, and that's a process that will work for a site that actually has behavioral.
It looks like we got another question from Dr. J. He asked, if you leave the form incomplete and come in the next day, will the info stay or will it get wiped out? Basically, you lose it. If you don't sign the form and you have to, one of two things will happen. You'll get that 15-minute window, which will automatically log you out. Or if you just log out or you exit that form without signing it, it'll keep the deployer's responses, but it won't keep any of your responses. So when you open up a session with the deployer as a provider and you're going through and you're doing your face-to-face or your assessment, you have to go through, complete that assessment, you have to sign it. Because if you exit out before signing that form, it'll delete all your comments. Deployer stuff will stay there.
Folks, can you check, make sure your phones are muted?
We have another question. If behavioral health signs off, will the provider be able to come back and sign off? As long as the behavioral health specialist signs before the provider, you're good. As far as them being able to open up the form, I'm a little unfamiliar with what responsibilities or what roles that the behavioral health specialist will have. I don't know if they're credentialed providers in the system. So if they're a credentialed provider and they sign off on the behavioral health portion, I don't believe they can sign the form as the provider.
For the behavioral health provider.
The provider signs
the
the
form that
form.
locks the form.
Right.
I'm assuming the provider is not on site. They're sending them out for a behavioral health consult and then having them come back. I'm assuming that's what's happening. We'll probably need to get with him offline to see what specific issue.
Dr. Day included his phone number. So
Gotcha.
are there any other questions for Mr. Valentine? Thank you for joining us today, and thank you to Chad Valentine and Phil Petronella for teaching providers and facilities. Spend a lot of time. We appreciate their time in making sure that we're doing it correctly. We will have a follow-up session next Thursday at the same time, 1 o'clock Eastern, noon Central. What we'll do is we'll follow up on any questions that are still remaining and follow up on any questions that were received in the survey. There'll be no formal agenda. It will just be a dialogue between the presenters and you all. So please join us to answer any remaining questions.
Standing questions that we did not answer at this point.
Correct. And then our next course will be at the end of April. It'll be on our TDAs and manpower. So Dr. Mark Perry from the MedCom Manpower Division will give us a course about
RPC?
Sorry, was there? Okay. So thank you all for joining us. We do appreciate it. I've put the link to the post. Please take a minute to do that. And finally, if you have not signed in, please sign in to the. Have a good day, everyone. Thank you.